Governor Charlie Baker announced today that all child care providers in Massachusetts will be closed starting this Monday, and the state is working on setting up emergency child care options for people like healthcare workers who have to keep going in. As for those who are still healthy, many are still struggling with the question, just how much should we be limiting our interactions with other people at this point? But the expert advice is clear. Stay home as much as possible. Such is the message from 16 prominent doctors and other healthcare professionals who recently co-wrote an opinion piece in USA Today indicating we're not doing enough right now to slow this outbreak. Among the authors was Dr. Asaf Biton, who joins me now via Skype. He's the executive director of Aradni Labs, a joint health center affiliated with Brigham and Women's Hospital and the Harvard Chan School of Public Health. He's also the author of another viral social media post, maybe the viral social media post on the subject titled Social Distancing, This Is Not a Snow Day, which has now been viewed by around 8 million times. Doctor, thanks so much for joining us. I appreciate it.
Thank you for having me.
In your piece, let me call it a primer on social distancing. You acknowledge how difficult it is when you write, this sounds extreme because it is. The American people have a libertarian streak. Are they ready to listen to this message?
Unfortunately, it's imperative that they do listen to this message. We are in unprecedented times with an unprecedented pandemic. And it is extreme because what we're asking them to do really has never been done at scale across our country, certainly in our lifetimes.
Well, some of the things in your prescription actually have been done since you wrote it. Schools have been closed in Massachusetts, a decent percentage of places across the country. You also say no gatherings. We know on the federal level, the president's saying 10 is the limit. In Massachusetts, 25. Does uniformity matter when you're sending such a strict message to people? Should the rules be the same for everybody everywhere?
It would be ideal if they were. Best principles of public health responses suggest that coordinated whole of government responses from the local to the state to the federal level work best to reduce confusion and get everyone behind moving in the same direction.
So no play dates. If you go outside, which is fine, stay 6 feet away from people. And if you are sick, try to isolate yourself from your family. Is there a pecking order in those things, or are they all equally critical here?
You know, I would say they're all critical. It is really important, especially if you're sick, to not go out and not potentially contact other people outside of your household. If you have the room in your household, really try to isolate yourself from others if you do get sick. But really, the most important thing is this idea of physical distancing. We have to keep our distance from anybody who's really not in our immediate household, unless we are an essential worker. Somebody who works in the healthcare system, in the grocery systems, for power plants, etc.
Has this been hard for you, social distancing?
Absolutely. I'm a primary care doc, and I'm a really social person, and I connect with others as part of my job and as part of my social life. It's kind of ironic a little bit, if you knew me, to be sort of the author of, one of the social distancing diatribes. But this is what's needed now. And I'm a public health person and a numbers person, and we really have got to do this now.
You acknowledge in your piece that social distancing can take a toll, but you don't really have a prescription for that. Do you want to share one now?
Absolutely. Well, if I were to update it with what I know now, and the pandemic changes our timeframes and our knowledge base so fast, what I would really emphasize and what I would call it is physical distancing, because that's what it is. This is about physical separation from others. We want to be physically distant, but we want to stay socially connected. Right now, my kids are, on 4 or 5-way Skype play dates, and, we're connecting with grandparents and loved ones. And I know that young people are finding new ways to connect with their friends and loved ones in different ways without being in physical proximity. It's going to take this ingenuity for us to get through this isolating period.
You know, one of my obsessions of late is every day on the radio we broadcast the president's Corona Task Force gathering, and it drives me nuts that they preach social distancing like you, as these experts stand shoulder to shoulder with the president and the vice president of the United States. Does that not make your task that much harder when the leaders of the country and the top experts are doing exactly the opposite of what you're recommending?
And what they're recommending as well. You know, it is ironic that there's a gathered group of, yesterday I saw 16 people all within 6 feet of each other. I think we could do a better job of modeling the best behavior. I mean, I'd love to come to your studio and I'm sure have a better picture quality than my camera phone on my computer, but I need to show that I'm practicing what I'm preaching, and that's why we're doing this on Skype.
You know, your message is the same pretty much to everybody, but I think what we've learned so far, it's only been a few days, is that there are a ton of 20 and 30-somethings, many of who were lined up outside those bars in South Boston Saturday night, who frankly just don't get it. Is there a particular strain of this message you could direct to them, or is it all the same for everybody?
You know, I've learned in being a primary care doc almost 17 years that you don't get people to change behavior by shaming them or making them feel bad. What you do is you offer them opportunities to be their best selves. So, you know, my message to 20-somethings or 30-somethings who want to hang out at bars is that right now you can be a hero by doing almost nothing. Meaning, be a hero by staying at home, and that stinks. And I get it. I'm going a little stir crazy too, but this is what's needed right now.
You know, Doctor, before you go, I have to say, when I first read your piece, and I'm emailing it out to friends like millions of people have done, I'm figuring you and some of your highfalutin doctor friends are in some lab off at the Chan School of Public Health conceiving of this message that became viral. That's not the genesis, though, from what I understand. Where did this idea come from?
All credit goes to my wife, Liz. You know, she saw this opportunity to really help clarify things in our neighborhood, in our community, when schools were canceled on Friday. And so she conceived of the idea to put these thoughts into an email, clarify it, make it really pragmatic and really helpful to people to decide what they're going to do differently now. So this is all really her fault and her credit, to be honest.
Think really local and then go global. Dr. Asaf Bitan, I really appreciate it. And thank your wife as well, will you please?
I thank her every day.
I bet you do. Thank you, Doctor. I really appreciate it.
Thank you.